Welcome in the Canadian Pinout Times show. And today we are with Josie Osborne. She is the Health Minister of the British Columbia, and she will let us know what she done and so far in the new government for improvement of the health for the BC residents. And welcome to the show. Okay, go
Thank
ahead.
you
Just
so
give a
much.
brief introduction and explanation what you guys done.
Okay, thank you so much. Thank you for having me on the show. I'm really proud and privileged to be appointed BC's new health minister, and I've been on the job for the last 4 months. And certainly, we've spent so much time during this time focused on the needs of British Columbians, and we know that people need better access, and we're working hard to strengthen healthcare across British Columbia. Focusing on attracting new doctors and nurses to our healthcare system, making sure that people have access as close to home as possible, and particularly talking about the need to increase facilities for people. So things like the new hospital coming to Surrey are a really high priority for our government. We're going to continue to take these actions and make sure that we're building out the healthcare workforce that we need, and that we have a really strong public healthcare system here in British Columbia.
Okay, you want to say anything else more?
Well, I could talk a little bit about the new hospital that's coming to Surrey. Construction is well underway, and I actually was able to visit this facility in just a couple of days ago. And it's going to bring 168 more hospital beds to Surrey. That includes a new cancer center as well and a second emergency department. We have been seeing the strain in the healthcare system, and that's impacting emergency departments, particularly in rural communities, but also just seeing longer wait times in centers like Surrey and Langley, in Vancouver and on Vancouver Island, really across BC. And so that's why it's so important that we continue the work that we're doing, expanding the UBC Medical School, building a new medical school in Surrey to train more doctors here, working to recruit doctors from the US and from other places in Canada. So we've made credentials it easier to access credentials for here and to practice in British Columbia. Really important for those people who are trained in international jurisdictions to be able to come here to BC and deliver the high quality healthcare right on the front lines where we need people. And we're going to continue that work.
Okay, related to Surrey Hospital, actually, what's the timeline when this hospital will be start? Because there's a no timeline. That's the big problem. Because in the 2007, they laid stone by the Gordon Campbell, but was no timeline. Then there's a long story short, they sold it, and then the new government came, basically, NDP, and in 2016, still like no timeline in how many years the hospital will start, actual timeline.
Well, this hospital is really important to people who live south of the Fraser. It's one of the fastest growing places in British Columbia and is underserved with the facilities that are available to people in Surrey. So our government is a government that understands this and has moved quickly, announcing quite quickly after we formed government that a new hospital would be coming to Surrey, and now the construction is well underway. So it is scheduled to be complete in 2029 and to open in 2030. And again, this will bring more hospital beds, a new cancer center, another emergency department to the people living in Surrey. And the progress is fantastic. So far, when I visited the site, of course, just a couple of days ago, not only just to see what's been accomplished so far, and people will begin to see the additional floors being added to the hospital, because all of the work that has to be done on the foundation and preparing the site, that work is largely complete, and they're going to continue to work, and it's on schedule. So that's really important to know. The site is the construction that's being led by Fraser Health Authority is, a high focus on worker safety, of course. And when I was on site myself, just meeting some of the people who are so proud to be working on a brand new hospital, the care and the work that is being doing to ensure that it is a safe work site, and to deliver this hospital on time and on budget is something that's incredibly important to the entire project management team. And I could really see that and feel that. So the hospital will be open in 2030.
Thank you. And in the meantime, like this is a problem, as you know, that Delta Hospital emergency was closed for a few days in last month. And you want to say anything about that?
Yeah, it is really hard on people when an emergency room needs to close temporarily. And people want to know that it's there for them. We've always been used to having an emergency department when those urgent and emergency things take place, and you need to know that it's there. That's why it's so important that the health authorities do everything they can. And I know they work really hard to mitigate the closures. And in Fraser Health Area, for example, over 99% of the possible temporary closures are mitigated. And so the public doesn't really even know about those. And it is obviously, really unfortunate when an emergency room has to close overnight. And that's why we have to continue to do everything that we can to attract new doctors, to train more doctors here, to recruit doctors coming from other places and really build up the healthcare workforce for emergency rooms. It's physicians and nurses, all the support staff that are required. And we're going to continue to do everything we can to support Fraser Health, for example, in these issues that have been experienced, particularly in Delta, for example.
You want to say anything about long delay in the emergency rooms?
Yes, sometimes when people go to the emergency room, they're facing some really long waits. First, I want people to know that anyone who presents at a hospital, at an emergency department, is triaged so that those people with the most urgent needs are taken care of very quickly. So, for example, cardiac arrest or heart attacks, that is something that needs to be addressed immediately. And that service is always there in the emergency departments. For people who are waiting for a little bit longer, it's really hard on people. And I understand that. And that's, again, why we have to do everything we can to build out the primary care system, making sure that people are attached to their own primary care provider or are able to go to an urgent and primary care center if one's available in somebody's neighborhood or in somebody's city or region, because getting those urgent needs taken care of and avoiding having to go to the emergency room is really important. Our government's also done work to expand the scope of practice for pharmacists. And so being able to visit your community pharmacy and take care of some of the needs that we're seeing that are presented at emergency rooms sometimes, everything that we can do to help people get care outside of the emergency room for those non-emergency needs is really important so that we can reserve the emergency rooms for those true emergencies. But right now we can see with the long waiting times that there's still a lot more work to do. And that's why, again, we're so focused on training and recruiting healthcare workers, creating safe workplaces for healthcare workers, and doing everything we can to support the teams that are necessary to make these emergency rooms function.
Okay, thank you. I have a question. It's related to the doctor association, because of the like who have an age more than 40, they are not. I'm not talking about all of them, but most of them, they don't feel comfortable on the virtual appointment. Can the doctor, you guys can talk with the doctors association, they should do at least 60-70% instead of the virtual appointment, the personal appointment. They feel more comfortable, or should be the patient choice. These days, some of them, I'm not talking about all of them, like some of them, doctor forces to the patient, no, 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 we can see only virtually, not personally.
I can understand having a relationship with your doctor is really important, and being able to see them in person is more comfortable for a lot of people. For some people, they enjoy the flexibility of virtual appointments, being able to talk to their doctor or nurse practitioner on the phone or through a screen, but that doesn't work for everybody. So when the Premier appointed me as health minister, one of the things he has asked me to do is to take a look at the way virtual care is being delivered. And while it was necessary during COVID, for example, during the pandemic, and we had to make some big shifts, that it's really important to look at getting the right balance. And so that's why we will be working with Doctors of BC, for example, with physicians and with the college to develop standards of practice so that people can have an expectation of how many visits may or may not be virtually delivered. And we're going to need feedback from people. So even this question being asked today and the feedback that you're providing me of what people are telling you is really important. So we're going to listen to patients, we're going to listen to the doctors themselves, and then we're going to work to develop and implement standards around virtual care.
Yeah, youngsters are okay. The old age people have difficulties. Yeah. And I have a question regarding the radiologist. For the MRI result is a delay. Like they do the MRI on time, like for the urgent care patient, but a result they get a very delay, like after 7, 8 days. Some of them after 10 days, because there's the shortage of radiologists on their website. Also, they want to hire more radiologists. Then government something will do, or they're increasing the medical seat, and they can increase the for specialization in like radiology or the heart care, and they have a planning to increase their seat also in BC.
Right. Our government is so committed to improving access to medical imaging and to the diagnostic tools that people need, like MRIs. And it's really important for people. It's important for physicians to have those tools for them. So since 2017, we've added 11 net new CT units in BC, and we've added 19 new MRI units. And as part of our strategy to deal with human human resources, and attract the right number of people, we need to know that we've got to increase the number of medical radiation technologists and radiation therapists too. So right now, for example, back in Surrey at Surrey Memorial, there's preparations for renovations in new suites for radiology, and adding a new MRI unit that has arrived actually this month at Surrey Memorial. And that's helping to ensure that there's shorter wait times and less disruptions in the diagnostic services that physicians need to provide for patients. So the MRI project and adding more MRI units, ensuring that we have the people to run those machines, it's part of our 30 prioritized actions that we are taking specifically at the Surrey Memorial site. So we're going to continue to do that work. We've been able to see the number of MRI exams going up 83% compared to back in 2017. The number of CT exams will have gone up 40% compared to 2017. And that's the work we've got to continue to do.
My question was like radiologist. You guys have enough machine these days. I agree, but the problem is that they don't have enough radiologists who can read their reports, because on their website they said we are a shortage, we are hiring more radiologists, right? I'm not saying they're, because they don't have enough radiologists in the BC. That's a problem, because they're not, you can say, as if you compare as a population from last 20 years, it's a huge increase in population, but a radiologist is less. I agree, so many machines are here, but the problem is that no one is there to read the report.
Right. That's why we have to continue to train more people. We've got to recruit more medical imaging technologists, more radiation therapists, and there's definitely more work to do. So we will absolutely remain committed to strengthening access to that kind of diagnostic technology, but we've got to continue to expand the training opportunities. That means investing in more recruitment and retention, and really the supports that are needed around that. So that means we've got to work with our health system partners, and that includes the Health Sciences Association, to really support that kind of training and retraining. So there's ability for people to upskill and be retrained to run some of these machines, and lots of opportunities for people in a really rewarding profession.
Yeah, I have a say suggestion or whatever, right? So BC government and the federal government, like they gave a paid training to the mechanics and the other trades, because the housing is short, right? Why not the government introduce the, okay, whoever do the radiologist or any other, then we will pay for them because there are so many grants to the housing projects and for the training to those people. And why not the government go for the health sector? Whoever will come, we will pay their tuition fee. Then more student encouraged to come in that field also.
Well, thank you for that. I mean, these are exactly the kinds of ideas that are coming forward in the conversations that we have with the Health Sciences Association, for example. So being able to provide bursaries and tuition supports. We already provide incentives for workers, for example, working in more rural and remote communities. And this is exactly the kind of work that we are considering and working with, like I said, like with the Health Sciences Association and with training institutions, so we can do everything we can to support people. Thank you for that. I really appreciate that question.
Yeah, and because this question comes because more youngster will come and give the incentive because there's a huge tuition fee. As comparison to if you go to trade courses, have a less tuition fee and the government encouraging them. If the people comes in this because of a huge tuition fee, they don't come in this field. And if you guys encourage them, okay, we will pay your tuition fee, then more people will come. And I want to come in the remote area, especially in the natives area. They don't have enough health facility, and remote area also. I just want to request to the government, like whoever the newcomers come and get trained, who the government paid the tuition fee, they should first 2 or 3 years should work in the remote areas. Then they will get a better health facility, especially in native areas, or you can say Mission or the Kamloops or the other area, Golden or the Clearwater area. They don't have any health facility. They have to go 2 hours or 3 hour drive to get a health facility. If the newcomers come, they will get a better health facility over there.
Those are excellent points. And that's the approach we've taken with international medical graduates, for example. So people who've been trained as physicians in other countries who come and practice in British Columbia, and for a couple of years they're supervised by a licensed physician here in British Columbia. And as part of that commitment, they make what's called a return of service commitment. And so working in a rural community for 2 years, for example, before moving on to live somewhere else. And we're seeing success with programs like this. And so, there is the ability to consider that and expanding that to other professions as well.
Yeah, in the last question, I have I just because many people don't understand that the universal healthcare system and private healthcare system. Can you explain that? What is the universal healthcare system? I know that, but if you, the minister, explained it, I know that people face difficulties. I talked to many people, and they always complained. I try to explain that this is a universal healthcare system, health for all. We have to face difficulties, and if you go to other countries, then they paid it, but that is not universal. Can you
Yes.
explain in last and what is the universal healthcare system mean?
Well, we are really proud in Canada of our universal healthcare system. It's a system that is publicly funded through tax revenues and other revenues that governments receive, and that we remove barriers for anybody to access healthcare. We feel strongly that no matter where a person lives, or what their background is, or how much money they make, that everybody deserves to have access to healthcare. And that means that when you go to see a doctor or you go to a hospital, that you don't have to pull out your credit card and pay. We want everybody to have that access. That's what universal publicly funded healthcare looks like. It's always been a central foundation to our healthcare system in BC for decades and decades, and we're going to continue to do everything to protect that for people. So that's why when you go to the emergency room, people will talk to you about the healthcare you need, but they won't ask you to pull out your credit card and pay for it that way.
Yeah, thank you. And sorry, I forgot to ask question. What the government is doing to work for the uh, remote communities for the health?
Again, no matter where you live in British Columbia, if you live in a community as small as Burns Lake or Clearwater, or whether you live in Kamloops or Surrey or Vancouver, we want people to have access to healthcare when they need it and where they need it. So that's why we're very focused on recruiting, specifically recruiting healthcare workers to join rural and remote communities to lessen the barriers that people face by supporting their travel costs. So for example, if you need to receive specialized cancer care, and that means that you need to travel long distances, that government supports the costs of those travel. In fact, for people, for example, who need to come down to Vancouver for very specialized cancer care, even their accommodation costs are covered, because it's stressful enough already to be able to have to face those healthcare challenges, and we want to reduce those barriers and challenges as much as possible. So I come from a very small town myself and bring that kind of lens to the work that we're doing. And we're going to continue to do everything we can to make healthcare access more equitable for people who are living in small communities, expanding cancer care centers, reducing travel costs, expanding the scope of practice for pharmacists so that you could go visit your local community pharmacist in a small town, for example, and get some of the healthcare that you need without needing to travel farther to get it.
Thank you very much, Josie. Much appreciated for your
You're
valuable
so
time.
welcome. Yeah, you're very, very welcome.
Yeah,
Thank
thank you.
you.